welcome to the Home Healthcare Today show. I'm your host, Dr. Cleamon Moorer. It is National Nutrition Month. Yes.
Every promise complete.
A quick stat about nutrition. 47.9 million Americans lived in food insecure households in 2024. That's 1 in 7 families uncertain where their next meal will come from. Among them, 14.1 million were children. Today's guest, Dawn Opel of the Food Bank Council of Michigan, is going to help us dive into topics as related to food insecurity and what the Food Bank Council of Michigan is doing to resolve this tremendous challenge. Okay, let me introduce our special guest, Dawn Opel, Juris Doctorate and PhD. Dawn oversees all internal functions of the Food Bank Council of Michigan. She's a lawyer and researcher. Her career has included positions in academic, nonprofit, and government sectors. And broadly, she works to build strategic partnerships for social innovation. Dr. Opel's particular focus is developing capacity in Michigan for food as medicine interventions in the clinical setting. And she is currently involved in the implementation and sustainability of fresh food pharmacies for chronic disease self-management in federally qualified health centers. She holds a PhD from Arizona State University and a Juris Doctorate from the University of North Carolina School of Law. Dr. Opel is an adjunct assistant faculty member at Michigan State University in the College of Arts and Letters. Dr. Opel, welcome to our show.
Thank you so much for having me.
So, Doc, please tell us about your journey. What led you from the vast array of careers and positions to focusing on food insecurity in Michigan?
Sure. So I started out, as you mentioned, I went to law school and was a legal aid attorney in my first career.
Yes.
And went back to school to get a PhD, really to look at sort of the structural conditions that create poverty and the social determinants of health.
Yes.
And so after that, I became a professor at Michigan State University, and I researched those topics for several years.
Okay.
But was working in community all around Michigan, and particularly working with the food banks, and eventually wanted to find a way back in where I would be representing community-based organizations and making impact alongside them. And so when I was introduced to the Food Bank Council of Michigan, they offered me the opportunity to sort of bring my research and strategy into the organization, and I'm thrilled to be able to bring that to the work at the Food Bank Council.
Wonderful, Dawn. So that is an excellent segue. Thinking about research, understanding the problem, and then diving deeper to saying, hey, I believe I could help to solve this problem. But particularly at the Food Bank Council of Michigan, for those that are unfamiliar with the Food Bank Council of Michigan, what is it, first and foremost, and how does it work to help to eradicate food insecurity in our state?
Sure. So the Food Bank Council of Michigan is the state partner association that represents the 7 regional food banks in the state of Michigan that are affiliated with the Feeding America National Organization. And then also those 7 regional food banks each have a network of partner distribution agencies or pantries. And the relationship between them is that the food bank is a giant, if you think of it like a giant warehouse, like when you pass the Meijer or Aldi warehouses on the interstate, huge warehouses that store food.
Gotcha.
The agencies, of which pantries are some, and now health clinics and lots of other partners, whether it be at a church or a clinic or a Salvation Army, those are all of our partners that distribute that food. So they come into the food bank, pull it out, and distribute it to people in need in their communities.
Okay, so I see the connection. So when people see the names, they say, hey, Forgotten Harvest or Gleaners. Those are agencies that distribute food from the food bank.
Yep. So Gleaners and Forgotten Harvest are the food banks,
Yes.
and all of the local agencies. So you think churches and
Yes.
Salvation Armies and all of these local community organizations that you probably know that are like on your street. They're the ones that come and pull the food out and distribute it in your community.
Wonderful, wonderful. Thank you for clarifying that, Dawn. Okay, it's National Nutrition Month. It's March. Why is it important that we just don't focus on feeding people, but let's make sure it's good and healthy food?
So there are real deep ties between food insecurity, nutrition, and health and wellness, and it's super important that we talk about those because if we are just feeding people with just calories,
Yep.
that doesn't necessarily ensure their health and wellness. And
Facts.
so it's very important that a healthy diet contributes to overall well-being over time. And so you want that food. It's really like putting food in your own personal bank to get all of those nutrients that you need to thrive. And so at the food banks, we're working really hard to make sure that the nutritional quality of what we're providing is of really, really nutrient dense quality so that
Definitely.
folks can get out there and lead their best lives with the food that we're providing.
I'm loving this. I love the connection here. So let's go there, Dawn. You started to allude to it earlier as we think about the health outcomes, and you talked about the social determinants of health, chronic disease, mental health, and even our children, childhood development. Can you speak to how food insecurity impacts the overall health of our community?
Sure. So in the short term, the chronic stress of
Yes.
looking for that next meal
Mhm.
starts to create it does a lot of things to your body. So
Yes.
that stress can create lots of behavioral health issues because you're full of anxiety and worried and have a lot of depression
Yes.
about finding that next meal. So there are lots of studies that link food insecurity to our mental health and wellness. Like, it is super important. But then also what you eat and how that affects your body over time will affect your everything from the incidence and prevalence of chronic disease.
True.
So you start to think about diabetes, kidney disease, all obesity, high blood pressure, all of those things. And then that starts to snowball, and we see those impacts in communities on healthcare costs, on productivity, on
That's right.
educational outcomes.
Mhm.
All of those things are connected to each other. So
Oh,
there's
wow.
sort of thinking from the individual person to then how that spills out and affects whole communities.
I love it. Yes, those are clear. Those are very clear connections, Dr. Opel. We got a little while before our first commercial, so we could dive even deeper. Okay, off the script, as we think about your background in law, right? The legal aspects, as well as access to food. What are some of the connections there as we think about a full and solid society?
Well, sure. I
Yeah.
mean, I think we all know that at the base level, that being fed
Yes.
is going to be your number one priority.
True.
It's like at the
True.
id level of the Maslow's
It
hierarchy
is
of needs, right?
physiological,
And
number
feeding your
one.
family going to be the most important thing, no matter
Yes.
what. So I think that there's a lot of. I remember that when I was a legal aid attorney, that really thinking about food, housing, thinking about how
Yes.
those base needs are met is the only way that you can then get to that
Yep.
sort of next level of being able to
True.
think about
Yep.
employment, civic responsibility, like
Yes.
all of these kinds of things. And
Yep.
and so I think that it is absolutely fundamental to a civil society that everyone have the fundamental right to food.
Totally. Totally. You got it. You got it. So thinking through it and just sort of thinking from bottom of the pyramid, Maslow's hierarchy of needs, the physiological needs, before I can get to safety and social and esteem needs, and the top of the pyramid, making sure individuals that are at the bottom of the base of our society, their basic needs are met is really critical and really important. Folks tend to stereotype food banks though and say, but it's canned goods, right? It's okay, the non-perishables, but let's dive deeper when it comes to like a full comprehensive meal for a family.
Absolutely. And I think that's really important because a lot of people, when they think about a food bank, they think about a canned food drive.
Yep.
And while that is absolutely important and a fundamental, part of the history and current, nature of food banking, what we have come to find, and unfortunately in our society, we now have to purchase a lot of food in order to meet people where they are and provide the food that that people want and need to thrive in society. So purchasing gives us the opportunity to be able to provide a well-rounded diet for folks, and that has definitely been the trend, is to work more toward the purchase of produce, lean protein, dairy, whole grains, really what you would imagine to be a healthy dietary pattern. And so that is definitely the direction that food banks and pantries have moved. In the pantry space, we work a lot more toward having cold food storage capacity so that we can store dairy and eggs and fresh produce, lean protein, and that we can have more fresh product available at food banks and pantries. So I think that when you walk into food pantries nowadays, you see something very different than what you think about from the early 80s when food banks were established.
Okay, I got to lean in now. So as a fellow professor myself, I am professor of entrepreneurship at Central Michigan. And I like to teach students, yes, there are the political factors, the economic, the social, the technological, environmental, and legal. We refer to it as PESTLE. PESTLE factors that impact all types of domains of society, right? So with that lead, one of those that sticks out is in your background, innovation. Let's talk about some of the social innovation as related to food distribution and trying to eradicate food insecurity.
I would love to.
Okay.
So the most important part of that is that food banks and pantries cannot do this alone.
Right.
And so when I think of social innovation in the food banking space, I think of a lot of cross-sector partners, and particularly healthcare. So that's one reason why I'm really glad to be here, because the role of healthcare in food insecurity is important and growing in terms of the relationship between the two and how we can better integrate those two institutions in order to make more impact. So a lot of the work that I've done has been bringing those two together. So how can we provide food access at a clinical site? How can we better understand the relationship between the food that we're providing and the health outcomes that and the preventative nature of that food down the line? So how do we work with the healthcare sector to be able to better understand like the return on investment? And that creates all sorts of new, really new ways of distributing the food, of measuring the impact of the food, and on providing food access in non-traditional locations.
Absolutely. I like that. So the non-traditional, because we know that in some of our rural areas, some of our urban areas that may have convenience stores versus fresh access to food, understanding Food Bank Council of Michigan, working with partners to be innovative in providing the access and the distribution, as well as in health clinics and centers, that creates what we like to refer to as partners, or partners in wellness, or partners in wellness management. Don, this is a very informative first segment of this episode. We're going to go to a commercial. When we come back, we'll talk more about your journey and more about the Food Bank Council in Michigan. We'll be right back. We went from podcast to broadcast. The Home Healthcare Today show is back. I'm your host, Dr. Cleamon Moorer. The show is sponsored by Meridian Health Plan in Michigan. Stay tuned. Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today. Hey, it's still National Nutrition Month. Welcome back to our segment. And we have the pleasure of having Dr. Dawn Opel from the Food Bank Council of Michigan. So we're diving into some deep topics here. So Dawn, we'll give a quick shout out to our sponsor. The sponsor of the show is Meridian Health Plan in Michigan. Meridian is the leading or the largest Medicaid HMO in the state. And Dawn, speaking of our partnership and collaboration with Meridian's parent company, Centene Corporation, right? I hear there's a great project that you all have going on.
Yes,
Yeah.
we're working on a fantastic demonstration project
Yes.
on rural food access. So we're partnering with Meridian
Okay.
um, to build capacity to have fresh food access that can work with a new Medicaid program
Mm,
called In Lieu of Services for Food and Nutrition Services, which is a new managed care authority
okay.
that allows us to pay for fresh, healthy food through the Medicaid managed care program. So in order for us to be able to participate in that program, we have to build capacity, and it's
Definitely.
sizable,
Yes.
especially in rural areas where it can be pretty far away to a fresh food access point.
True.
So we're working in Southwest Michigan to build essentially a network of fresh food agencies across that region, including some of our healthcare partners. So it's a very exciting project. We're also partnering with Meridian on the In Lieu of Services program and
Hmm.
also on some other pilots related to the social determinants of health. So we very much enjoy our
Yes.
partnership with Meridian and see a very bright future ahead.
Wonderful, wonderful. Well, congratulations.
Thank you.
Congratulations, Dawn. Dawn, going back to our people, around Southeast Michigan, Southwest, the entire state, as we think about food insecurity, beyond cost of food, because, that's a headline and a reality for many families. Beyond cost of food, what are some of the other barriers of access for folks?
Sure, there are several. And I
Yeah.
would say I always start with transportation
Yeah.
because moving people to where food is very hard to do. Reliable transportation, whether it be a car or a bus line access or a caregiver that can take someone to a food distribution outlet, that can be very, very difficult, especially reliably for a lot of folks.
Yes.
And so often that is a very large barrier. It's not the largest one, though. We also see barriers with the ability to prepare and cook food. So,
Yes.
as you know, foods that come out of food banks and pantries are often whole foods that have to be prepared.
Yes.
So that can often be a barrier. Can often be not having a heating element or cold food storage, or the time
Yeah.
to prepare food. So
True.
that is another big area. I would say also a few other barriers include linguistic barriers,
Hmm.
digital literacy barriers to find
Hmm.
where the food distribution points may be in the food bank and pantry network. So we often see that, and we try to assist with navigation
Yes.
in lots of different ways
Absolutely.
to be able to get food to the folks who need it.
Hey, this is great. Thank you. Thank you, Dawn. Let's move a little further here as we think about the barriers. We got those added barriers of cost, transportation, the time that it takes to prepare food. You even talked about the linguistical barriers because there are multilingual residents in the state of Michigan. There's also a digital divide to an extent where if there's access to a computer or mobile app, there's still sometimes challenges in knowing the next step. I think that's where we come in. I think partners like home healthcare agencies, hospitals, nursing homes, different healthcare providers, we're able to act as liaisons or intermediaries to an extent. How does the Food Bank Council of Michigan work with organizations like ours to alleviate some of those barriers?
Yes, this is my favorite topic
Let's
because
go.
we are
Yep.
partnering with healthcare partners in a number of different ways. So,
Yes.
some of them is to actually embed the food access at a clinical site or at the point of care.
Okay.
So that can be the home health coming to the person's home
True.
with the food with them.
Okay.
And so we have done home delivery. We've partnered with federally qualified health centers that do pharmacy delivery to
Yes.
actually put the food with the medicine, which is
Okay.
very important because a
Yes.
lot of them you have to take food with the medicine. So,
Definitely.
so providing that food access as a part of that is really important. And also, that was just very convenient because we could use that infrastructure to just layer right on.
Like
And
it.
that's what I look for is like, where is home delivery already happening? And how
Yes.
can we leverage that infrastructure in order to get that food to the people who need it?
Wonderful, Dawn. It's very helpful. And we also, run an eye clinic, Eye Care for Detroit, doing business as Eye Care for Michigan. We would love to explore opportunities, to be able to provide access to food at an eye clinic, right? Because we see where some folks may stop off at a vending machine and they're trying to put together a meal at that vending machine. So to be able to provide a resource for folks beyond vision care and home health,
Working together is definitely the way. I think that it will make your outcomes better, and
Yes,
and ultimately people healthier and happier. So it's
totally.
really looking to where we can better leverage what we're already doing, because transportation is
Yes,
very expensive for
true.
food, and logistics to move food
Yes,
is very expensive for food banks.
absolutely.
So we've got to look at like who's moving already, and like
Yep,
how do we get that food going there, and those are
absolutely.
the kinds of efficiencies that I'm looking for,
Okay,
because
true.
reinventing the
No,
wheel there is very expensive for every sector to have to
yes.
figure out how to cover that.
You
So
got it. And the sandwich generation. So the working adult who is responsible for taking care of their aging parent or loved one, as well as a household full of younger adults or young children, and then trying to juggle all of that. So, hey, I'm going to get you to your doctor's appointment, and then we got to figure out dinner or we got to figure out a meal. I see where you're going. I see where the opportunity is to partner and to merge some of these activities. Dawn, let's keep going. Food deserts. We hear a lot about food deserts. Can you explain what that means and how a food desert affects communities right here in Michigan?
sure. So the way I like to explain it is everyone probably has a story of a grocery store near them closing.
Yeah.
And and you may have had one that was walkable,
Yes.
or that it was only a mile or two away, it was on your
True.
bus line,
Yep.
and then it may close for whatever reason. And then as a result, you are now living in a neighborhood where there's nowhere to walk to be able to purchase or receive fresh fruits and vegetables,
True.
lean protein, all of those things, the fresh food. And so when that happens, it can affect your health and wellness, and it also really causes people to have to drive very long distances, and it's further exacerbated by
Yep.
the costs of food right now. So
Right.
what ends up happening is you drive very far for where the cheapest food is.
Yes.
But the problem with that is that when that everyone struggles with convenience and time and pressure, and
Yep.
so as a result you're going to go for what's easiest and quickest and nearest to you,
True.
and so that ends up affecting your nutritional
It
quality.
does.
And so
Does.
we've been working on several different ways to address to combat that, but that is definitely an issue in Michigan in both urban and rural settings.
Absolutely, it is, Dawn. And I've been encouraged as of late as I drive through a lot of the neighborhoods in the city of Detroit. I'm seeing urban gardens, right? I'm seeing where folks are taking it upon themselves to examine and test the soil and go back to agricultural roots of saying, hey, let's try to plant something here, and that's very, very encouraging and inspiring to see. Ideas like that help, but what are some of the other things that an average resident in Michigan can try to do to mitigate food insecurity for their own family and for others in their community?
Sure. So
Yeah.
I think number one, volunteering in your community where there are the coalition of the willing to work on this.
Yes.
So another issue is volunteerism. As we work more and more hours and life
True.
gets harder and harder, it's
Yeah.
harder and harder to go to
Yep.
to your church pantry and volunteer.
True.
Or and to be honest, it's that core group of people that keep food access available in communities,
They do.
and they are doing that out of the kindness of their heart. So
Yeah.
to the degree to which you can chip in and give a few hours
Yeah.
to your neighborhood church pantry or other agency,
Yeah.
that is super important. And so I would say that first and foremost, that we're all in this together, we're all
Yeah.
a community, and we've got to do what we can. But obviously, also, we always say that donating to your food banks and pantries is super important. And I would be remiss if I didn't also say that that our buying power allows us. We do love to get
True.
donated food, but cash really does allow us to buy at a 10 times greater.
Yep.
I'm not sure if that's scientifically accurate,
It's okay.
but
Yep.
at a much larger ability to buy. We our purchasing power goes far.
Absolutely.
So I think that's another thing that can be done. But also just looking at where, really looking in your community where healthy food, where it may be farming, it may be urban gardening, it
Yep.
may be farmers markets, it may be like where are folks really working on agricultural production and distribution in your community. Get in there and fight for it, because it's important.
Absolutely, Dr. Opel. What gives you hope? You're giving so much great insight and information for the viewers of the television show as well as listeners to the podcast. But as we look out, going into the next several years, what gives you hope? And are there some current success stories that you want to share with us that let us know, hey, we're making progress here.
Sure. So I
Yeah.
would love to start with this year, the Food Bank Council of Michigan hosted the very first Michigan Food is Medicine Summit
Mm,
at Michigan State University.
yeah,
We sold out
great.
the Kellogg Center Conference Center, which I think really speaks to the interest in the state
Yeah.
of Michigan that there is to do more work to connect food, nutrition, and health.
Yep.
And we had just a very robust representation from healthcare, from
Yep.
state government,
Yes.
from community-based organizations of all kinds,
Yes.
food producers, farmers,
Love it.
doctors,
Yep.
everybody's there saying, we know this is
Yes.
important and how do we do this?
Mhm.
And so that really gave me a lot of encouragement that there's just so many people around the state really trying to figure this out, how to do this work better together.
Yes.
But also I think the stories of being in clinic, working on food as medicine initiatives for some years
Yeah.
also really inspire me to hear individual stories
Yeah.
of just an individual patient who may have gone from having an uncontrolled A1C and not knowing how
True.
to control
Yep.
diet, insulin, and to going through a food as medicine program where they receive the food access, really start to be, preparing healthy meals over time, see that behavior change, see that improvement in health and wellness, and then really see,
Yes.
just how that changes their lives.
Absolutely.
So that really gives me a lot of
It,
hope.
it sure does. I get it, because when you talk about controlling some of the numbers, whether that be BMI, whether it's weight, whether it's cholesterol, HbA1c, and looking at healthier food as a choice, but then how to prepare that food as well as how to access it and then lead a sustainable, healthier life is so important. Okay, Dawn, so it's not pie in the sky. Our last few seconds here. For the person that's watching that says, all that sounds great, I need food today. We're struggling. What do you recommend? What step can a person take to put some food on the table today? What should they do?
Sure.
Yep.
So I would say there's a couple of places to go to look.
Okay.
The first, if you have internet access, to go to our website. It is fbcmich.org.
Okay.
That has a food bank and agency directory online. So that's probably the fastest way.
Yes.
You can also find there in Lansing, we run a statewide food and other resources helpline for people in need. So if you're in crisis, need food today, need help, potentially applying for public benefits, anything like that, you can call the helpline. And I actually wrote the number on my hand because I want to always make sure I remember. It is 888-544-8773. And you can also find that on our website. But I think that is the fastest way to get to a human being that can help you navigate the charitable food network and also help with public benefits assistance if you need it.
Dr. Opel, I'm going to repeat that number for listeners and viewers. That is 888-544-8773. Dawn, this has been an excellent episode, packed with information, insight, and hope. And I believe that together we can mitigate food insecurity in the state of Michigan and beyond. Thanks for coming on to our show today, Dawn.
Thank you for having me.
Folks, that does it for this episode of the Home Healthcare Today show. We'll see you next Saturday, 10 a.m.